Every year, countless mothers face mental health struggles during and after pregnancy. Yet in much of America, these struggles remain unseen. Perinatal mental health refers to the emotional well-being of mothers from pregnancy through the first year postpartum, a critical period for both mother and child. During this time, mothers may face serious health risks such as diabetes or hypertension, while newborns may be vulnerable to conditions like jaundice and respiratory infections. These physical and emotional stresses, combined with the drastic changes of pregnancy and childbirth, can lead to depression, anxiety, or even psychosis. But for the nearly 121 million Americans living in healthcare deserts, which are rural areas with little or no access to medical services, barriers like transportation, lack of funding, and shortages of healthcare workers make timely diagnosis and treatment nearly impossible. Therapist Danny Salzer works with mothers struggling with mental health and says that one of the many struggles of theirs is how isolating and tiresome the work can be without others around to help during the new and exhausting time caring for an infant.
That for women, like, if they don't have enough support, that's really difficult. So often in the past, you had a whole village, you had maybe sisters or cousins or aunts that were helping you with the baby. And so if a woman is doing it, alone and she's having difficulty sleeping and she might be waking up every 2 hours to nurse or to feed the infant, then that sort of stress can be really overwhelming on her system.
In addition, Dr. Thakkar, a psychiatrist, talks about how social isolation and the busy schedule of taking care of a baby and the lack of postnatal care can create stress and anxiety, further worsening mental health for new moms.
I think the biggest concerns that we see with perinatal care is I think the prenatal care is available, but perinatal there is a lot of when you're especially the first time mom requiring more mom supports, anxiety being a new mom, sometimes not having friends or social isolation because you are taking care of your baby 24/7, lack of sleep is one of the things that really affects them. And sometimes it's hard because when the partner is busy and not paying attention, also leads to more of the feeling of more isolation and feeling no support from anybody at that time.
Digan DeVay is the Director of Mental Health and Addiction Services at El Camino Hospital and oversees inpatient, outpatient, and emergency room patients of all ages. Here he speaks about healthcare inequity.
The healthcare equity has always been an issue in terms of the financial. Some people who have insurance versus some who don't have insurance are underinsured. And when we talk about healthcare parity, though we say that mental health and physical health should be considered equally, there's always the bigger challenges when it comes to providing resources for patients who come in for mental health reasons as opposed to physical reasons. It's easy for someone to get treatment if they have a heart attack.
In addition, Mr. DeVay talks about the lack of healthcare workers in both rural and even urban America.
As it is the state of mental health across the nation, in terms of the number of psychiatrists, the therapists, they are so low and such in critical shortage that even in urban settings, it's hard to find. But then to extend it to rural settings, where as it is, they're also spaced out, it's really, really hard to provide that resources to them.
Overall, healthcare deserts deepen the challenges of the perinatal period. In rural America, shortages of healthcare workers, high costs, and gaps in insurance coverage create barriers that make mental health triggers like depression and anxiety even harder to face.